name is Sarah Jean. I am the health department spokesperson, and I'm joined today by Dr. Richard Bruno, Multnomah County's health officer. And before we get started, if you are not speaking, if you could turn your camera off and be on mute. And if anybody needs recording privileges, please just drop a chat. Looks like we might be able to approve it automatically. And I am going, Amelia, do you have what you need? I think I just approved it. Let me see. Yeah, you should be able. Okay, great. Okay. Julie, if you could get Allison Rogers recording privileges as well. With that, I'm going to hand it off to Dr. Bruno.
Thanks, Sarah. Good afternoon, everyone. I'm Dr. Richard Bruno, Health Officer for Multnomah County Health Department. And I'm here today to provide an update on a health matter at Lane Middle School in Portland. I want to inform you that an individual at the school has been diagnosed with active pulmonary tuberculosis, or TB, and I join the school community in wishing this individual a quick recovery. TB is a bacteria that spreads through prolonged face-to-face contact with an infectious individual. It's very curable with medication, and because the infection progresses slowly, it's important to be treated to prevent serious illness. The Multnomah County Health Department is working closely with Portland Public Schools, the Multnomah Education Service District, and leadership at Lane Middle School to take all the necessary public health actions to keep students and staff and the wider community as healthy as possible. The school remains open, and we are taking comprehensive steps to ensure that it's safe. TB is an infection that spreads through the air when someone with active pulmonary tuberculosis coughs or sneezes or sings. It's important to understand that TB doesn't live on surfaces, and it's not spread by casual contact like shaking hands or sharing food or touching surfaces. People are not likely to get TB from someone just walking by in the hallway or from a brief encounter. It's not easily spread like the common flu or the common cold. People usually get infected as a result of close face-to-face contact for several hours with someone who has active TB, and this typically means daily contact over a period of weeks or months. If TB develops, it usually takes months or years for infected individuals to experience symptoms. People who are infected can take medication to reduce the chance of becoming ill, and TB can be effectively treated, and almost all patients are cured. The Multnomah County Health Department works with around 30 cases of TB a year. Our communicable diseases team has immediately begun a contact investigation. This involves identifying individuals who may have had close or prolonged contact with this patient during the time that they might have been infectious. The individual reported having symptoms for approximately 6 months. TB is hard to diagnose without a blood test, and we'll be offering free TB blood screening tests in the Lane Middle School community in the coming weeks. Potentially exposed individuals have been contacted by the health department via an emailed letter. And while we're taking these proactive steps, we also want to advise families and staff to be aware of the symptoms of active TB, which can include a persistent cough that lasts for 3 weeks or longer, chest pain, coughing, blood, or phlegm, unexplained weight loss, fever or night sweats, and fatigue. If you experience these symptoms, please call your primary care provider's office to determine the best way to get evaluated. People with inactive TB, also called latent TB infection, do not have symptoms of TB and cannot spread TB to others. We understand that this is concerning, and we want to reassure the community that we have experienced professionals managing the situation. The success of our efforts to identify any additional cases relies on the full participation of students and staff and families, so we really do appreciate that. We have a dedicated phone line for questions, which is included in the information sent to families and staff, and it's 503-988-3406. Thank you so much.
If people have questions, you can go ahead and use the raise hand feature and we will call on you. If you can't get that to work, you can let us know and I'll call on you. Austin, you can go ahead.
Yeah, thank you. And thank you, Dr. Bruno. I'm just curious, and you kind of explained this a little bit already, but I mean, how did it go for such a long period without being diagnosed in this particular instance? And when was it officially diagnosed? Are you able to share that?
Yeah, thanks, Austin. Yeah, TB kind of lingers for a while. It often progresses very slowly. It usually has very mild symptoms that get progressively worse. So it can be really challenging to diagnose. This particular individual had symptoms that were kind of mild for a while and got worse. It was eventually diagnosed, I believe, a week ago.
I believe I'm next. Hi, Ariel Yacobazi with Coin 6 News here. Just a clarifying question. You may not be able to answer this, but since this is at a school, can you confirm if this was a student or maybe a staff member, and if there's any extra danger towards younger kids with tuberculosis?
Yeah, thanks for the question. We can't disclose the status of the individual just to protect them at the moment. But however, tuberculosis isn't typically spread very easily among younger folks. It's typically older folks who typically are the ones to spread it more commonly. But that's as much as we can give you at the moment.
Allison, you can go ahead.
Hi, yeah, Allison with KGW News. I'm wondering if there is a TB vaccine, and if so, if that's something that kids commonly get, or what the protocol is on that.
TB is pretty rare in the United States, and it's not one of the American College of Immunization Practices, ACIP, recommended vaccinations. It is more common in other countries to have what's called the BCG vaccine. At this moment, we don't think that this is going to be a high risk situation for individuals at the school community. So vaccination is not commonly given or recommended in this instance.
Leslie?
Hi, Leslie Dominique, KPTV. How did the school district or the district in general first learn about the tuberculosis case?
Yes, we've been very closely in contact with PPS and MESD, and so we've been working on developing a plan and making sure that we can provide testing for any individuals who may have had close contact.
Amelia?
Thank you. I'm wondering if you have any understanding of how this person became infected and what the context is of sort of the broader transmission of tuberculosis in the United States right now.
Yeah, thanks, Amelia. We are still doing a lot of our investigation work, and so when we have more information about that, we may be able to disclose it, but we don't have that to disclose at the moment.
And Bruno, do you have anything to add about larger context of tuberculosis in the United States?
Yeah, like I said, it's pretty rare. We take care of about 30 cases in our Multnomah County each year, and in other counties it's much less. We probably have the highest count in the state, but typically outbreaks of TB are quite rare as well. Like I said, you have to have very long, sustained, prolonged exposure to somebody with active tuberculosis to really spread to others.
We'll go with Victor next, and then Amelia will come back to you.
Hi, it's Victor with K2. Okay, so you got this one person that since they've been infected or showed symptoms, have you gotten anything else from anyone else who has come in contact with that person? And did you find out about this today, or when was it?
Oh, thanks for the question. No, I'm not able to disclose a lot of the particulars of the individual and their current status. We were obviously notified as soon as the initial testing that had been done came back positive, and we're working very closely with this individual, as we do with all individuals with TB in our county, to make sure that they can get treatment and heal and get cured.
Amelia?
Thank you. Do you have an estimate for, even just a ballpark at this point, how many people did have close face-to-face contact with this person? I think that's sort of 9 months of potentially having had TB, which seems like a lot of potential for exposure.
Yeah, we're working really closely with the school to identify those close contacts. I don't have a number for you that I can disclose at the moment, but we're working on identifying close contacts because we'll want to make sure that they have opportunity to get tested with a blood test. first, but we'll open it up to anyone in the school community as well. So we'll be working on all those logistics, and we'll have more details for you in a few days.
And why a blood test as opposed to a skin test?
Logistically, the blood test is much easier since it's a one-time collection of blood that you can run and then have results back within a day or two. TB skin tests are a lot more logistically challenging because you have to place the tuberculin test under the skin and then have it read a few days later. So it's just a little bit more challenging to get those results properly identified and communicated to people.
Austin?
Yeah, is the county aware of any other active tuberculosis cases right now?
Yes, we take care of a number of folks in our TB team, typically around 30 per year. And so, we have other sporadic active cases that we're caring for.
Leslie?
Hi again. Has there been a prior history of TB at the school or in the district?
I don't know the answer to that, Leslie, in terms of at the school, um, or within the district. I know that we have a number of folks that we are currently monitoring for tuberculosis and helping them with treatment. I want to also mention that with the testing that we do for folks who want to get tested, we will make sure that any access to testing and treatment and any other diagnostics are provided free of charge for anybody who would like those.
Thank you.
Antonio, we can follow up with you. We might be able to have somebody help you with that. Are there any other questions? If not, Austin, go ahead.
Yeah, I'll just jump in one more time. Do you happen to have an estimated number of active cases for 2025?
I can get that for you,
Okay.
Austin. We track all the we have an internal database of all of our all the infectious diseases that we treat at the health department. So yeah, we can get you those numbers.
Thank you. I appreciate that.
Sure.
Amelia?
Thank you. You mentioned that you're working with the school on, just the school environment, making sure that it's clean and safe. Can you share a little bit about what you do in this situation, whether it's, there are any additional air quality measures or how you evaluate the environmental safety of the school environment?
Yeah, we're working really closely with the PPS and Lane Middle School leadership to do a tour of the school to see if there are any parameters that would make things at higher risk for the community than other places. Typically, we want to ensure that the environmental area has, proper ventilation. Some of the larger areas or larger rooms may be less conducive for spread of infectious diseases like tuberculosis. So we'll be doing that type of evaluation as well. And I think it's also just important to note that TB typically is the risk is pretty low from school exposure. So there's not a lot of school outbreaks for this type of infection, and that a lot of times individuals with TB, their household family members never even get TB. So it's not very fast or effective at spreading. It's certainly not as easy to get as the cold or flu or COVID.
Well, if there are no other questions, thanks everybody for coming. Feel free to send your questions over to us at pressoffice@molco.us. And I know we're planning on having Bruno available tomorrow if especially TV folks want in-person interviews. Reach out to us in the morning and we can work on setting those up. Thanks everybody.
Thank you.
Thank you.
Thank you.